Hi, Jamie Davis here from the Nursing Show here at ANIA 2015 in Philadelphia. We're talking nursing informatics. I have Antoinette Thomas here to talk a little bit about her nursing career and how other nurses might want to think about making the jump from clinical bedside nurse to that nursing informatics specialist to help assist with getting technology to that clinical bedside nurse. So Antoinette, first off, let's talk a little bit about why you wanted to become a nurse, how that career progression happened.
Sure. So I always loved the biological sciences in high school, but this was the mid to late 80s, and at that time it wasn't really cool or in vogue to be real vocal about saying, I love science and I want to pursue something in the scientific fields or the medical fields or the nursing fields. So I always remember excelling in biology, and I had a really, really great biology teacher who he kind of knew it and he pushed me along. But I ended up deciding to go to school to study textile science, so fashion, textiles, and I knew the first semester that it wasn't what I should be doing. So I finished the school year out, and I went home and I did a little soul searching, and I decided to completely change course, much to the dismay of my parents, although they were kind of glad that I was figuring things out, and I decided to enroll in nursing school. And I remember the first quarter of nursing school, it was so hard, but I knew like this was the place for me, and I just embraced it. And I would also say, like, most nurses are somewhat creative. So nursing, there is a lot of creativity in nursing, even though it is very scientifically based. So I was fulfilling that scientific side and that creative side at the same time.
So you went in, you started working in critical care, I understand, eventually became a critical care nurse practitioner.
Yes.
And but you started really enjoying working with technology. Tell us a little bit about how you shifted from that clinical nurse for you in your career to looking at, I want to be involved heavily with technology.
Sure. So I always describe the camps that are in nursing, and there's usually a camp that's, okay, technology's here, it's a pain, it's getting in the way of me doing my job. And then there's the camp of, yeah, this is kind of painful, but we'll get through it and we'll transition, and somehow on the other side of this is going to be helpful to us. And I just decided early on that I was going to be in that camp of, all right, I'm going to tough this out, and I'll adjust my workflows around it, and it's going to help. And I can always remember, I remember my first job was in the pediatric ICU at Medical College of Ohio, and when I started, we didn't really have technology other than the IV pumps, the basic IV pumps, and the basic ventilators at the bedside. And we had a med cart where we would pull our own meds, we would mix our own drips. And then one day the announcement came that we were going to get something called a Pyxis med station. And we got trained on the med station, and it was a complete turnaround into the way we did our work, and it was painful. But I really knew, I recognized that this was A, number one, going to keep the patients safe, and B, it was going to help bring down costs for the hospital and control, how the medications were distributed and administered in the hospital. So I embraced it. But I remember as time went on, the EMR comes into play. There's more bedside technology with devices grabbing information. And I would always say to myself, this is really great. This is going to make the patient's life better. And somehow, some way, I'm putting data into these things. Where is it going? Where is it going? What does it mean? What are we going to do with it? And at that time, I really knew nothing about structured versus unstructured data, and there was a lot of unstructured data going on at that time. But I always knew that was sitting somewhere like an asset to be used. And fast forward, 17 years of clinical practice, I decided to take the leap and try to do something in technology. And at this time, I'd say early to mid 2000s, there wasn't really a lot of opportunity inside the hospital for nurses. And I had sat on a couple of committees, selection committees for different technologies, but that was the main outlet. So I decided to leave clinical practice and go out into the industry. And I went to work for a company called Alaris, who were the first company to manufacture an IV pump that had software in it and communicated with a server. So all of the information that was programmed into the pump or put into the pump by the nurse was downloaded into a server. And again, it was all about safe medication delivery for the patient. And I thoroughly enjoyed that job. And then I had the opportunity to go and work for a small startup company in Cleveland, Ohio, called Exploris, which was just recently acquired by IBM Watson Healthcare Group. So that experience was very transforming for me because I had the opportunity to work with customers all over the country to take all of this disparate data that we were generating and get it into a cloud and get it standardized so they could apply analytics and metrics to it. And that was kind of the full circle for me because I talked a little bit earlier about all of the unstructured versus unstructured data and this asset that could be used for the greater good. And I think now with everything that's going on with the changes from the fee-for-service to the value-based care, that data asset is coming to the forefront.
It really is, and it's important. And now I know you've moved on and working with OneView Healthcare. We interviewed your colleague Grace earlier, and we'll have to put a link to that in this video as well, just so people can find it. It's a great company. Seem to be doing a lot with patient engagement.
Yeah.
But we want to talk a little bit about your advice to that nurse that's maybe watching this, that's thinking, what can I do? What's the best way for me to transition from a bedside nurse? I really love technology. I want to look at a career in nursing informatics.
Sure. I would strongly suggest there's a lot of programs now that are offering nursing informatics as kind of like a sub-minor or a focus of study in baccalaureate and master's degree programs. And so I would recommend that if there are nurses or students that are already in a program that have that interest, to take those courses and have a little bit of that background before they go into their first job. I do recommend that they practice some level of hands-on bedside nursing because they have to make the connection between patient and technology. Then they can articulate the connection between patient and technology when they decide to move ahead into some sort of either informatics or technology job. But the way to really get themselves to where they want to be is to, go to their leadership and volunteer to be on any technology acquisition committees, any policy and procedure committees. There's always workflow groups that are going on around the EMR, other technologies. And so that's the way for them to get a taste of what it's really like. And then find a mentor, either within their own institution or outside the institution, that can help guide them and give them advice on making the transition.
And that's what organizations like ANIA are so great at. I mean, our professional nursing organizations, whatever your specialty is, I think are really vital to helping you move forward in your career, network, and find those mentors, and eventually become that mentor yourself.
Yeah, and I was having a conversation with, I've been a member of ANIA now for a couple years, and also a member of ANIA, the Medical Informatics Association. And there, you see what we have 500 people here at this meeting now. It's growing every year. But I was having a great conversation yesterday about, just the ability to be around your peers and to review some of the research that's been going on. And also, how do we take what we're doing and translate it into the fact that we are still practicing nursing. And I think there's a lot of fear in new nurses that it's not really the practice of nursing, but in fact it is. And it's practicing nursing, and it's actually helping groups of people versus one patient where you're standing at the bedside. So if they can feel comfortable with that, I think, and have a good mentor, they're going to get to where they want to go.
Yeah, we've talked with a lot of people about that here in the conference interviews about how there's a mistaken impression about nursing informatics that you're no longer a clinical nurse.
Right, or that you don't matter in some
But
way.
you are impacting the clinical outcomes for patients all over a hospital, rather than just a single group of patients you might have on your shift, or a single patient if you're in a critical care environment. And I think that is really important to understand, that you have that clinical impact. It's very real, it's very definable, and it's something, if you really look, you're an informaticist, do the research and see what the impact your change had. And you say, that was the change that I had on the clinical impact in my hospital.
I agree completely.
Well, Antoinette, thanks so much for coming on the show. Thank you so much for coming by the booth and sitting down here, and hopefully we'll get a chance to run into each other again.
Thank you so much.
And I want to thank all of you for checking out this segment here for the Nursing Show at ANIA 2015 in Philadelphia, talking about nursing informatics. Remember to check back on this channel for more segments just like this one, or you can head over and find more over at nursingshow.com.